Welcome to Ask Dr. Tom. We connect with Dr. Tom to talk about all things health and wellness, cancer treatment, etc. This is Ask Dr. Tom with Dr. Thomas Incledon. He's the founder and CEO of Causenta Wellness and the Causenta Cancer Treatment Center in Scottsdale, Arizona. From working with NFL, MLB, MMA, world-class athletes, and even the White House, Dr. Tom's reputation of personalized medicine and cutting-edge technologies have put him on the map for caring for some of the most powerful people in the world, making him one of the most sought-after healthcare professionals of our time.
Let's just dive into just a definition of infertility for people that are like, well, what does that mean? Does it mean that I have slow, for guys, I have slow swimmers? Like, what is the definition of infertility for people?
Yeah, so let me just maybe give you a textbook definition. So infertility is commonly defined as the inability to get pregnant or maintain a pregnancy after adequately trying for 12 months, and in some cases for a full 6 months without medical assistance. So basically, you're trying to get pregnant and you can't. And so it's kind of biased in a way where it's looking at like the woman more so than the guy in the standard definition, if you will. But if you remember what I said earlier, it's a two-person show, right? It's not like one person without the other. Now, granted, yes, you can get a sperm donor, and you can still, have in vitro procedures done to have this process started outside the body. But generally speaking, for most people, it's a two-person show. And the reason why I keep emphasizing that as we go over some of the key stats later on, you'll see that it's pretty equal. Like a lot of stuff is pretty consistent across the board. So you can't just say it's one or the other. It's like both people have to look into things. One thing that I do want to point out is that when we look at a lot of statistics, most of the data predefined age range. And what I mean by that is somewhere along history, somebody said, well, we're going to keep track of women, or let's say in some cases, I guess, girls from the ages of 15 to 44. So let's say if someone got pregnant before the age of 15 or gets pregnant after the age of 44, the data is not as robust or good. So there's a lot of speculation and guessing. And so the reason why I share that is I can't tell you how many people come in and they say, well, my OBGYN or my other doc that I'm seeing for the in vitro stuff said these stats. And the point I'd like to make is that data has some bias or flaws in it, and it's based off of other people. Those people never had the precise level of detail that we can offer any patient. So if you randomly try stuff and it doesn't work, you can't always criticize the procedure because there may be stuff about the individual that wasn't known. So for example, a genetic contribution or exposure to chemicals. Yeah. Right. So let's just say, like, without my knowledge, I got exposed to pesticide residues and that damaged my sperm. And now if I was in a process of trying to, have a child with someone and, it's not working, I wouldn't know why. Now, if they did a sperm motility assay, it might say, hey, the sperm are jacked up, they're damaged, but they're not going to know why they're jacked up or damaged. And the same thing for a woman that has egg cells. If they're damaged, they may not know why because they're not measuring all these other contributing factors. So, so sort of the take home on the infertility side is a lot of bias is kind of looking at it from the perspective of the woman's side. And maybe the connotation is that it is a problem on the woman's side, but we know that it's not complete enough, or it's not really that accurate, because you could have problems on the male donor side, you could have problems on the female side, and so you don't really know until you actually measure both what's going on and then what the best solution would be. Well, there's a lot of key stats. So just reading off some numbers right now. 7.4 million women, or about 12% of women, have infertility issues. So that's a pretty significant amount. For people with infertility, 1/3 of the time, the infertility is attributed to the female partner. 1/3 of the time, it's attributed to the male partner. And 1/3 of the time, it's a combination of both. So it's pretty evenly balanced. And then as we kind of go through some of the stats, 1 in 8 couples have trouble getting pregnant or sustaining a pregnancy. And that translates out to like 12% of married women. Approximately 44% of women with infertility have sought medical assistance. So that means the majority of women that can't have, let's say, a successful pregnancy, they haven't sought medical assistance. So essentially, then they'll have a difficult time, for a while. Of those who seek medical intervention, approximately 65% give birth. So in other words, out of the 44%, then 65 of that 44, right? So you're kind of down to like maybe 28%, if you will. Then approximately 85 to 90% of infertility cases are treated with drug therapy or surgical procedures. Now, part of the reason why that's such a high number there is that's the only tools offered. So imagine if like you said, hey, Tom, what's my options? And I'm like, it's drugs, more drugs, and surgery. So you're not going to see other options there. Then fewer than 3% need advanced reproductive technologies like in vitro fertilization. And the most recently available statistics indicate that the live birth rate per fresh non-donor embryo transfer is 47%, or 47.7%. If the woman is under 35 years of age, and 39.2% if the woman is age 35 to 37. So again, these are just stats where they look at all women and don't take into account what makes them unique. So by comparison, we've helped all kinds of women over the age of 50 have successful pregnancies with no signs of any type of chromosomal damage to the child when they were born or anything like that. And I mentioned earlier about the average cost of a single cycle of in vitro fertilization in the U.S. about $12,400. But many times people have to do multiple cycles. So that's how they get, between that and all the other things that they're doing, the cost of the drugs and the cost of other variables like the testing, that's how they get up to about $150,000 to $300,000 or more.
What are the factors that, specifically in women, Dr. Tom, that you would say control the fertility or infertility in their experience in their lives?
There's quite a bit. And I think what I'd like to make sure people kind of get out of this is take-home message is there is more stuff you can control than there is stuff you can't control, right? So a lot of times what I hear people saying is, well, I have a genetic issue. And they don't realize the genes are like a switch. It's not a guarantee. It doesn't mean it's like a prison sentence that there's no other options. You have to do it, et cetera. So I'll kind of just go quick through this list briefly, and then I'll kind of add a little more detail afterwards. But things like sleep, alcohol intake, STDs, these are either current or previous exposure, smoking, exposure to certain chemicals in the workplace, environmental chemical exposure, obesity, caffeine intake, nutrition intake, genetics, medical problems like hormone issues or injuries. And then other concerns would be things like microbiome dysfunction. So like not having enough good guys, too many bad guys, and then over-exercise and overwork.
So I'm asked all the time by patients, what's the difference between personalized medicine and traditional medicine? And in traditional medicine, there's a singular approach. So you have cancer A, and for cancer A, here is the standard of care treatment. And after you go through the standard of care treatment and it doesn't work, typically there's not a plan B. There's not another option. So then patients are told, hey, there's nothing else that can be done. And so then they're convinced that, hey, there's no hope and we can't do anything else. Now I want to contrast that in a personalized approach that we have at Causenta. We're going to measure all kinds of details within your body. And we're going to find lots of areas that we can actually improve your health. And then indirectly, by improving those areas, we're going to help you do a better job at fighting cancer. So where someone else would say, hey, there's nothing that could be done, we're going to say, hey, there's lots of opportunity here to improve your health and make sure that you have a better quality of life so that you're able to function and live life under your own terms and not just waste away in a bed in hospice somewhere and watch everything go by you as time passes on. So if you or a loved one has been diagnosed with cancer and you're looking to get help, I strongly encourage you to go to Causenta.com and fill out the form at the bottom of the page and find out for yourself how we can help you.